Hello, hope you can all hear me. Can you confirm if you can hear me or not? And we are ready to get started. Very hope you can all right. So yes, I am here. Hello, everyone. And a topic highly debatable, highly controversial: pills and injections for weight loss. And knowing that the semaglutide is storming the market in India, and lot of pills and injections based off of semaglutide, which have been released in 2026, the generic version of what is the right approach for weight loss. We are going to, and what I'm going to offer here today is an objective view. There is a lot of debate, there is a lot of judgment, there are a lot of things that are happening on the market in the market right now. Some people are judgmental. How do we reach this? Right? So that is what is going to be today: weight loss, pills, and injections. Are they? What should we do? What should? So with that, hello. I'm a certified fitness trainer, nutritionist, specialist in exercise therapy from International USA. I was recognized of India, awarded by Times of India and Economic Work in the area of health. And the biggest pleasure, apart from our academic qualifications of the number of people that we serve, any of that, the biggest happiness and pleasure that is by seeing real transformation, not just physical. So with that, a warm welcome and thank you for joining. Before I get started, just a quick thing. Usually I pick up topics. It's just an excuse for me to open up a conversation with you. So I'm here actually to answer your queries and get to understand your challenge, so I can help you. So if you can do one questions right away, because by the end, what you hear and what I see, what I hear. At the end, there could be chances that I do not. Any questions, fitness, health, mental health, emotional mastery, no matter what it is, exercise, nutrition, and anti-inflammatory nutrition, detoxification nutrition, in the chat box, and I will definitely, because this is primarily to answer your questions, okay? All right, so with that, let's get started. Is a pill medicine. It is a drug. It has been approved by the Drug Association, and it is already released in the Indian market to help people with type 2 diabetes as well as obesity. So the names that we have available right now under the which uses semaglutide are Ozempic, Belsas, one is Monjar. Yes, are available in 2026. Drug will be available. So what is that? That is available is quite expensive, not very easily available, and the public, 26. There are a lot of generic versions that are the generic versions of this drug. Will not only storm our market, which will make it very easily accessible, number one, and number two, it will be much more economical also. So you see, and it will be prescribed by the doctors, and the doctors are someone that we really highly trust, and coming from the doctor, market will definitely increase. So what is then, so what is semaglutide? Let's understand that first. A lot of clinical research, if it has been released in the market, it means that it is safe for consumption. Let us understand that first. And there are a lot of medicines in the market, and every medicine has a side effect, and every medicine is there for a purpose. So if it is a medicine and it is released, it means it is approved and it has gone through clinical, which means it is safe for general public to use. Prescribed by a medical practitioner, because it is a medicine, we cannot tell that for us. Neither can we prescribe others. If we are not in a medical profession, we cannot prescribe it. Start using. So then, and then through the, what happens is this drug is used and tested of people, and statistical data is collected. What kind of benefits are they saying? If the drug is promising that they can show cardiovascular, type 2 diabetes is shown on majority of the population, they identify that as the potential benefit of that drug. And then during the trial, they also see what are the potential side effects and the number of people who suffer from that side effect. That is also documented. And if the side effects, the cons of the drug is much more than the pros of the drug, then the drug is not allowed to be released at all. So one thing we have to understand, that these are safe drugs to be used, which will be administered to the patients by the doctors, and it will be done on prescription itself. Am I promoting it? No, I'm here to give you an objective overview. This is how clinical trials work, okay? I'm in the health and fitness field, and we work on the preventive side. We do not work on the curative side. So if you ask any health and fitness professional, our dream is that our coaches will never have to take any medicines ever again. They can live a medicine-free and a disease-free life. That is what our dream and vision is, but is that a reality? No. Right? And that is why drugs are here to help us as well. Medicines are needed. Healthcare is needed. There is a role that prevention plays, and then there is a role that curative treatments play as well. So having said that, the pros, after having gone through the clinical trial, the pros that has been identified is number 2, type 2 diabetes. People get relief from type 2 diabetes. It has also been shown to reduce obesity in people. People are getting cardiovascular benefits, proven, research data-based. Okay, people are getting cardiovascular benefits. Not just to mention that, people are also getting liver benefits. People who had fatty liver, non-alcoholic fatty liver, these people are also getting benefits. So there are a lot of pros. It also, every medicine comes with a con as well. So let us understand the cons also. All right, before I go into the con, okay, let me say the con and then I can come to how does this drug work, okay? So the cons are, many people see digestive issues. Yeah, it has been reported by a few number of people. What has been reported is loss of lean mass. So you lose the weight, but along with that, there is a loss of muscle also reported. The other problem that people have reported is Ozempic face. You know, it's a mango-like face. One doctor that I was talking to, he said, use this term, chusa hua aam lagta hai, but he does prescribe for people who needs it. So chusa hua aam. So that is the Ozempic face that people talk about. Saggy skin saggy and loose skin becomes common because there is weight loss. Is it because of drastic weight loss? No, there is no drastic weight loss with any of these drugs. It is in a slow and a controlled fashion. These are not sudden weight loss pills. It's slow and a controlled fashion because it works by managing your insulin levels and slowing down your digestion, slowing down the movement of food through your stomach. And hence you do not see drastic weight loss. However, this is the side effect that you get a chusa hua feel, you lose muscle, and some people have also reported digestive issues. Other than, there are other cons also been reported, but I'm taking up the main ones that have been reported by people and through the clinical trials. Okay, so now the question is, what do we do about it? Yeah. Now, you know how the drug works is, the drug works by balancing, giving you an insulin boost. Whenever there is an insulin boost, the sugar levels come down. When the sugar levels come down, automatically our cravings reduce. This drug also works by, and type 2 diabetes, you get relief from type 2 diabetes, and you also get relief from PCOS. So this is how it helps. The another way the drug works is it slows down the movement of the food through the stomach. It slows down emptying of the stomach. And hence the food is sitting in your stomach for a longer duration of time, making you feel full. And hence you will not crave food. The third thing that it does is it alters a signal in the mind which says that you are not hungry. So it takes away your hunger and takes away your craving. That the hunger signal does not reach your brain. And hence you do not feel hungry and the stomach feels full. With all of this, what happens is the quantity that we intake reduces. And when the quantity reduces, when we cannot eat the food, then we will definitely lose weight, right? So all of this comes together to give you something like type 2 diabetes, benefits of type 2 diabetes, as well as benefits with obesity as well. Now, having said that, what should we do? Now, I'm here to give you a very realistic approach. Yeah, many people are fearful. A lot of people are saying another drug for weight loss, supplements, pills. This is not what we want. Some people are scared. Some people are very happy and excited because they feel that there is something now which is becoming easier. Lifestyle changes, accepting it. I have been in the lifestyle field for a very long time. I have, now I'm 50 years old, close to. I've been exercising for the last 28, 29 years. I have been very consistent, but what I always failed to understand was I can exercise any time of the day, then why do people find it difficult to exercise? What I started realizing when I matured, when I grew up beyond 21, yeah. When I started my own health and fitness organization, I started realizing that it is very difficult for people to make lifestyle shift. And that is why today India is a country where the obesity rates are very high and it is only increasing. India also has high rates of type 2 diabetes as well as cardiovascular diseases. Yeah? So it is difficult for many people to make lifestyle shift, and the condition of India is not looking great right now. Yeah, we are a country who has started to become we have started to become a prosperous country. A lot of money is floating around in this country. However, a lot of poor health is also floating around in our country. So it does not give a very great picture. And hence, I want to bring a very objective view without being judgmental and without scaring off people that do not use drugs and do not use pills. As long as I know that this is a safe one, which has been approved, gone through clinical trials, it is safe to use. But then how do we use it? One of the cons, before I get into that, sorry, I forgot to mention that one of the cons is this works. This is like any other medicine. This will work as long as you take it. The drug will work as long as you take it. The moment you stop, it will stop working as well. So you will see relief from type 2 diabetes. You will see relief from your cardiovascular health. You will see relief from weight loss as long as you take it. But the moment you stop it, all of that is going to come back again. All right. So that is also, you may think of it as a con. I don't think of it as a con because that is how medicines are supposed to work. When you have a cough, you take the medicine, you won't have the cough. When you don't take the medicine, the cough will be there. You have fever, you take medicine, fever will go. You don't take the medicine, fever will not go until the time your body has healed. Right? So that is how medicines work. And if somebody complains about that, I will question that. That is how medicines are supposed to work. They are not going against expectations of how the medicine should work. So then having said that, given that it is, if you want to see long-term weight loss, sustainable weight loss, how then can we use this pill? Will I have to use it for the rest of my life? Even if I attain my target weight, do I still need to attain it? Do I still need to continue to use the medicine, pump in chemicals into my body? These are the questions many people are having. So some people are judgmental. Are dekho, they take medicine. I do it myself. I'm a very fit person. Some people are fearful. Are Baba, what will now happen? Especially in the health and fitness industry, there is a lot of fear. There is a lot of, people are getting a little insecure because weight loss will not remain a market anymore in the health and fitness space. It will move more in the treatment phase. So many of the people are fearful and feeling insecure. Many people are happy and excited because these people have tried many different things. They have gone into diet programs, exercise programs. They lost weight, gained weight, lost weight, gained weight, and they have gone into a perpetual weight gain loss cycle. And these people are very happy. Are kuch to milega yaar, something I can do that I don't have to sacrifice my laddus, my jalebis, my biryani, and I can still lose weight. Yeah. So some people are very excited. These people are also excited because they do not want to eat less. They want to eat. Yeah. There are people like that. I've been talking to many people, very friends, very close friends, loving friends, doctors, people from different kind of profession, and this is what I'm getting to hear. Many people are very, they are educated. I'm not, these are educated people who are saying that they would like to have it, and so they are logical people. So there is, so there is no room for judgment. Instead, there is a room to understand in what circumstances, in what way can we bring in preventive and curative side together to still have sustainable health for us. And that is what I'm going to cover for you. Now, having worked with many people, I do understand that there is a segment of people who need this drug immediately, because I have known people who are very obese, they are morbidly obese, and yet they are unable to follow lifestyle practices. And I have encountered them in our own programs that after a certain while, we got frustrated and we had to tell them, I cannot help you till the time you try helping yourself. These are 100 kgs plus people, okay? So when I later realized that these people do not have the ability to stop eating at the right time. What happens? The mechanism of this body, the biology of this body is that there is so much of fat in the body that the leptin signal and the leptin and the ghrelin signal, which is the fullness and the satiety signal, does not work in their body. It does not, even the signal does not reach the brain. So the brain does not know when to stop. And they become compulsive eaters. They become food addicts. Even after they have had a full meal, they feel like eating something. They cannot stop themselves from eating. And that kind of, and the more the body fat they have, the lesser this signal is. Yeah, so the signaling pathway doesn't work. And these people are not able to, even if they know that they shouldn't eat the wrong kind of food, they know, but their brain doesn't work like that. The brain is a set of neurons that are working. The neurons, the firing, the activation does not happen the way it happens in a normal weight person. Okay. So that is one. Now, just imagine a person who is 100 kgs, morbidly obese, with type 2 diabetes. These people are at a huge risk. And at that time, if we wait for the preventive measures to take on nutrition, exercise, lifestyle habit, can they do it? They can do it. But they are at a very huge risk, and that needs to be tackled immediately. And that is where the pill helps. For example, when we have people in our program and they come to us with 8 point HbA1c levels of 8 or TSH levels of 11, the first thing I tell them is our program will work for you, but first we need to bring this out to a proper level. And then, because preventive measures take time to take action. However, the curative measure, and that is the benefit, advantage of the curative measure, the English medicine, where it addresses the problem very quickly in a short period of time, right? So if your blood pressure is going 200 by 100, I cannot sit and give you, I will still give you good nutrition, exercises, meditation, all of that. But at that point in time, the focus is to keep you safe, keep you secure, because it's not just your life, your health, it's your family's future that is dependent on you, right? So, and hence we give you even when we induct people in the program, first, we analyze what level they are at and do they need a combination? Do they need a treatment plus a prevention? So that assessment anyway happens. And if we find someone who are completely off, then we do start the preventive measures, but ask them to take the treatment as well. Now, having said that, so these are the people who are at very high risk, need to start on the pill immediately. Yeah. And so that they can start bringing down their risk. And I know it will help many people. I have known many people who find it very difficult to stop eating when they should not be eating. And that can help those people. Now, how can we make this work long term? Now, the thing is, they will keep dropping weight. But beyond a certain point, they will have to, if they have to sustain it, they will have to continue to have these. Muscle loss will also happen during this time. So now let's understand how we can bring this both together to give a win-win situation for both the patient who is going to turn into a fit person, and the health industry and the fitness coaches as well. Yeah, a win-win solution for each one of us. So how does this work? Is if the muscle loss is happening and you are on treatment, the best thing is at this time, club strength exercises while you are having the pills. which will help you not just to accelerate the process because you're building muscles at the same time. It will up your metabolism. And it will help you to prevent bone loss, osteoporosis at a later age, osteopenia. It will also help you with, as is up the age of 35, sarcopenia, not sarcopenia, but muscle loss sets in. At a later age, sarcopenia sets in. So it will at least ensure that you are not losing your muscles, because we need muscles for the later part in our life more than what we need at the 40s and the 50s. So it will ensure that you are preserving your muscles and you are boosting your bone health as well by doing strength exercises. The second thing that needs to happen is whoever, not you, but whoever is on this treatment, how it will work is, as you're on this treatment, also start to activate your brain and digestive channel the pathway, the signaling system. Work with an experienced coach, work with a health coach who can help you identify food that can reset and regulate your ghrelin and the leptin pathway, so that when you start training your brain for fullness and hunger by the drug. If when you take the pill, it will not train your brain. It will just stop the hunger and it will make you feel full for a long period of time. But this is the time when you can utilize, anybody who is going through the treatment can utilize to reset their hunger and fullness signal to the brain, so that when they stop taking the pill as well, when they slowly reduce the dosage of the pill, they will start relying on their signals to stop eating when they don't need to eat. Okay, so these are the two things: train your brain and do your and definitely do your strength exercises. If you at all choose to go with the pill, that will not only give you a lot of excitement because you see faster progress, it will accelerate your progress. And if the doctor has given you, definitely it is safe. But look, over a period of time, look to reduce this dosage and get back to a life where you can sustain your own weight loss while building muscle, because weight is a very low hanging fruit. That is only the beginning of your health journey. That is not the end. That is how we start in our program as well. Weight is the lowest hanging fruit. In fact, I sometimes tell people, if you're coming to our program for weight loss, don't even come. There are many cheaper programs at the market. Please go and take those up. And now it will become even cheaper with the drugs and the pills. So please use that. If you come to us with a mindset of hormone rebalance, boosting your metabolism, having a fit, tight, and a toned body, being able to do things at 50, 60, 70, 80, regardless of your age, your fitness level goes through the roof. And you're not someone who's dependent on wheelchair. You're not dependent on walking stick. You want to be a person who wants to explore and experience the world with your feet. We are earning a lot of money, but if we cannot explore the world on our feet, we cannot enjoy the world on a wheelchair or a walking stick, right? And if you have those kind of dreams and those kind of desires, where you want to run a marathon, you want to go for trekking, you want to go for hiking, you want to play with your grandkids, you want to play football with your grandkids, if those are the kind of aspirations you have, we are here for you. Okay, so with that, I've come to the end of today's session. I hope you found it valuable, and I'll be ready to take on a lot of questions from you today. Hi. Yes. Ready to take on your questions? So then let me ask you a question. If given a choice to have a pill versus, and I have absolutely no judgment, it's a very safe drug to use. It has been, it has gone through clinical trials. So my question is, an option for you to use a pill versus lifestyle choices, which one will you pick? Short term, long term? And tell me, you can give me two kinds of answer. One is an emotional answer, what would you do? And one is the logical answer. Yeah, oftentimes we do not Oftentimes we do not take decisions logically. Most times we take decisions emotionally. So emotions have to be, have to be understood as well. Okay. So what would be your option? Pills and injection or no pills and injection? What exactly? Right. So if you have the answer, I'll be logging off now. I do not see any responses, but that doesn't mean that I'll not be checking responses after this. So if you miss the opportunity to put in your question or tell me your option, which one you will take, put it in the comment box. I will come back and check on it. And if you have a question that you want to ask me, do put it in the comment box and I will come and personally answer your questions. Okay. So with that, thank you so much for joining in today. And yes, please do share this with your friends and family because this is becoming a reality very, very fast. Okay. Thank you so much. Take care. All right. Manisha responded, I take decisions logically. That's wonderful. Take care. Thank you so much. And I'll see all of you soon. Bye-bye.